Welcome back to the American College of Surgeons Bulletin Brief from the Frontline Surgeons' Voices. With me today are Dr. Chris Buzas, who's the head of colorectal surgery at the UPMC Central Region, and Dr. Caroline Park, who's an assistant professor of surgery and acute care surgery, trauma and critical care at the University of Texas Southwestern Medical Center and Parkland Memorial Hospital. Welcome, Dr. Park. Welcome, Dr. Buzas.
Thank you.
Thanks for having us.
Well, thanks for being here with me today. Firstly, and maybe we'll start with Dr. Park, when did you become a fellow of the college, and how frequently have you attended the annual clinical congresses?
Well, I actually just recently became a fellow of the American College of Surgeons and was inducted virtually, actually. So it's been just about a year now, but I attended the Congress for several years now when I was a bright-eyed, bushy-tailed resident, walking around this amazing Congress within the halls and, being able to sort of listen to all the master educators. So it's been a few years now, but have been able to see such incredible growth, both physically and also the virtual footprint of the Congress, and so excited to see the direction that the Congress is going.
Fantastic. And how about you, Dr. Buzas?
So the first time I went to Clinical Congress, I think it was 2008. And it was an amazing experience, just seeing how big and how vast the program was, and just seeing how many people and from so many areas. I became a fellow in 2014, and I think since then I've only missed the Congress once because I was on call.
Well, that one certainly, excuse me.
Yes.
So let's talk about the specifics of the virtual clinical congress in 2021, and maybe we'll start with you, Chris, and tell us what your experiences were last year.
Well, I thought it was actually very well run. I don't think we missed out on any of the content just because it was virtual as opposed to being in person. And, as a young surgeon, it actually, I think, got me more involved because being in my office and being in a comfortable place, it encouraged me to actually be able to ask questions and comments as opposed to if I was in a huge auditorium. So I think it actually enhanced my experience because I was a young surgeon.
How about you, Caroline?
I'm gonna reiterate that. I think that the sheer volume and size of the Congress is fantastic, but I think you have to get your running sneakers on because you're literally running from one session to the other. And I think the virtual component made it much more accessible. And also, certain panels that I may not necessarily attend to, I tend to gravitate towards the trauma critical care, but other ones like the more, the minimally invasive and the robotic surgery, which is certainly a field that, we're sort of creeping into as well, were really lovely to be able to attend. So I really enjoy the accessibility that the Congress provides in that format.
Did you, Dr. Park, go back to any of the content after the week of the annual clinical congress last year as it was available online?
I did. And I think, well, going back to the chat function, I think that was nice because it kind of allowed folks to, be a little bit more comfortable with asking questions. But I was able to access content afterwards. And I think for folks who, want to, keep up with their CMEs, it is a great alternative to do that and to be able to keep up with it since the content's available for, several days after the Congress.
Great. So, Dr. Buzas, have you registered for this upcoming one?
Have.
October?
Yes.
Great.
So I actually, I registered for it when it was still supposed to be in person. So it was kind of it was a downer when it became virtual. But actually, it is what it is.
Have you had a sneak preview of the program to see what entices you?
As a colorectal surgeon, I'm definitely interested in the colorectal aspects, but also just the minimally invasive and also robotic, as Caroline was talking about, are things that are also interesting to me as well.
There's a few additions this year that weren't offered last year, such as the didactic courses, and I don't know if either of you registered for them, but it's a very interesting format where all the lectures are going to be given as coursework prior to the 2-hour or 1-hour, 50-minute session during annual clinical congress, and that hour and 50 minutes is going to be strictly interacting, as we've just been talking about the chat function. So interacting with the faculty live. So it's kind of like being in a college or grad school course where the prerequisite is you've read this book, now you come to class to talk about it, and so it's going to be a different format. And there's even an element being introduced where approximately 4 to 6 weeks later, the group reconvenes, the faculty and the registrants, to talk about how practices change. So it's quite a clever format, I think, something different this year. So there's several other things that have been introduced. If we had an elevator pitch, let's say, and you were talking to another similarly aged colleague who wasn't familiar with Clinical Congress, why would you tell them, Dr. Park, why would you tell them to attend your little elevator pitch?
Well, I would say, look around, look at the diversity of the surgeons that are here in terms of, expertise and breadth. And I think that the Congress, again, has called an incredibly diverse program, all disciplines, and challenging a wide breadth of learners, right, including the medical student and then the experienced master educator. We all have something to learn. So, not only learning about the basic sciences behind that, but also the clinical aspects of surgery. But of course, within this past year, we're being much more intentional about our, efforts to improve diversity, equity, and inclusion. So I'm really, really happy to see that the Clinical Congress is doing that. And of course, with, the focus on resilience and clinical excellence this year, I think is especially on point because this year has been very challenging for all of us. And then for me personally, I am honored to be the Young Fellows Association liaison to the Committee on Trauma. So I'm so excited to do that, to see what the Congress has to offer this year. I think everyone's going to have something to get out of it. So definitely join, definitely, check it out.
Fantastic, sage advice. Dr. Buzas?
The main thing that I enjoy about the Clinical Congress is just interacting with other people that I usually don't interact with. You get to see people from other parts of the country, as well as people from other countries. And I don't think that there's many opportunities to do such things as the Clinical Congress. Also being the YFA liaison for the NAPRC, it's nice to see, nice to meet with people like yourself, Dr. Wexner, who you probably wouldn't meet with normally as a young surgeon, just because of the differences in the length of time that you've been a physician. So I think that it's a really good opportunity to interact with different people, learn new things, and just have a good time doing it.
Well, I'm looking forward to having a good time doing it, and looking forward to hopefully seeing both of you in person in 2022 in San Diego. But for the moment, we'll see each other virtually in 2021. So thanks for your time, for your reflections and insights, and I'm sure both of you stimulated some people who hadn't thought of attending to attend.
Thank you, Dr. Wexner.
Thank you, Dr. Wexner.